Hello and welcome to this episode of Clinic Wahala with yours truly, Dr. Kach. On this episode of One for the Road, the human body is something wonderful that God has made, delicately and well made. So many cells, organs, tissues, systems working seamlessly. And there is a reason all these parts were made. I'm talking about this issue of someone who has a food poisoning. Food poisoning in the sense that you ate something that is decaying or that has some bacteria inside of it, and you eat it and it multiplies in your tummy and starts giving you features of gastroenteritis. That's what we call it medically, where you are having some tummy upset, you are having diarrhea, passage of watery stool, and sometimes you are vomiting. It's still peculiar with our own society where we don't have regulation. Many of us will go and pick some antibiotics from the chemist and from wherever they can, they just pick it. And they will also add a drug they call anti-motility drug. One of them is loperamide. There's a popular drug people take whenever they have diarrhea. They mix everything for them and they take it. The loperamide is an anti-motility, meaning that it stops the movement of things in the digestive tract down and out through the anus. So of course, many a times when you do that, it stops the diarrhea, it stops the stooling when you take the loperamide. In fact, I know somebody, friend, that's his stock in trade. Whenever he has diarrhea, he eats, and once he's infected and he has diarrhea, he will rush and take loperamide. The reason I'm doing this video is to warn you that it's not the best thing to do. God has created this body seamlessly in a way that for the digestive tract, food and the contents therein move up, down, and out through the anus. In fact, we are taught in medical school that if you turn somebody upside down, put his head on the floor, raise his leg up, and he swallows food, it will still go up the digestive tract and do whatever he wants to do and get away through the anus. We call that force peristalsis. Peristalsis, that particular system that moves food from mouth down through the intestines to the anus, and you take away feces. You take away feces. So that is not just kept there because we are supposed to use it and eat and it takes down food and all. It's also a protective mechanism. Yes, it's kept there to protect us because you see that digestive tract. Anytime you take any sample from there and culture, especially the intestines down, you will see microorganisms. So many microorganisms. There are so many that stay inside there, and yet many of them do not infect us. So for this particular one, when you eat, that whole system that takes the food down also helps to make sure that these microorganisms do not stay static and multiply so many and give birth to so many cells that will eventually cause overwhelming infection. So that movement will be like before the microorganism establishes itself, that force moves it down and out through feces. It's a protective mechanism for everybody. That's how God made it. But when you take anti-motility, when you have that gastroenteritis, that food poisoning or the infection in the gut, when you take it, you stop the motion. Yes, you stop that whole complex, that force that moves it down. The anti-motility is aiming to stop that motion, and it will now go and lock up the exit point, so to say, and these organisms will be like, nothing is pushing us. So maybe in 1-2 hours they're supposed to double or triple. Imagine keeping them there for 12 hours. Of course, they will multiply madly. Yes. and lead to very devastating infection that can kill. So you see the reason why these things are that way. That's how God created it. So when you have a food poisoning or a gastroenteritis, you need to rush to the hospital. Yes, you need to rush to the hospital. You need to get to a doctor who will assess you. And if the history and examination and everything points towards a bacterial infection causing it, he will treat you with antibiotics. If it points towards other things as the cause, he will tackle based on that cause. It's not by stopping motility and you feel good. You can expose yourself to overwhelming infection and that will kill you. So always be wise. Always do the right thing. So I implore you and I urge you, desist from taking anti-motility whenever you have diarrhea. It's good you're assessed by a doctor who gives you the best treatment for that. I know say Nigeria, the setup is a bit funny, but the little we can do, we still do it. Thank you for listening. Do well to share. Some other people need to hear this so that they don't kill themselves by themselves. Have a wonderful day. Don't forget to like, share, and subscribe. Thank you.